I'm going to introduce Mr. Prostate. And that's our friend right there. Our prostate, every man's got one. As you age, they get bigger. Lots of things happen to them. Two things we care about. One is they get enlarged and they can block the flow. And that's what I'm going to talk about, voiding dysfunction that relates to the enlargement of the prostate. It's a benign disorder. It's, in a sense, an inevitable disorder in most men. Dr. Alani is going to talk about prostate cancer, so I'm going to just skip that for the time being and let him handle it. There's a lot of words people use when they talk about enlarged prostate. BPH, that's just kind of the histologic changes, the microscopic changes that occur as the prostate grows. Eventually, it gets big enough that a doctor can feel it enlarged. He calls that BPE, or enlargement, or your prostate got big on you. And at some point, the bigness can start to block the flow of urine, and that begins to cause symptoms that eventually will drive a man to seek help if he's being honest with himself. Turns out she's the one normally telling him to get going. And what happens is that as it begins to block the urine flow, the men start to get up at night. They start to go more urgently. They start to go more frequently. You've probably noticed this, that as men age, the flow of urine begins to slow down. So when you have almost no gray hair, your flow rate is very high. And if you've been at a Cardinal game recently and you got behind a guy who had a lot of gray hair, you were waiting up on him because his flow becomes very slow. So these can be troublesome. In some circumstances, they cannot be healthy for an individual at all. But for most men, it's more bothersome than it is a detriment to their health. It ruins their quality of life and has some other changes, let's say in sexual health, but they're not deadly, generally. So one of the therapies that we use to affect it is a class of drugs called alpha blockers, and it has a lot of customers in there. Flomax, Rapaflo, Cardura, Hytrin. You've probably heard of these. But basically, these were blood pressure pills initially that have an effect on the relaxation of the prostate. And when you take this, it can improve the men's urination symptoms relatively fast. Within a couple of days, he can say, "Doctor, it's different." This is just an example of the types of changes we see. They are substantial and they're immeasurable, but not everyone responds. About 70% of men will respond initially, and someplace around 50% will stay on the medication after a year, meaning it works for a while and then either they think it's not good enough or they decide to move on. So there's another type of pill that we ask for men to take, and it's a different approach. It's a hormonal approach. One of the causes of that change in prostate size is change in hormones effect on the prostate, begins to cause it to grow. And so by a very specific type of medication, we can block that growth. And as we block it, the prostate then begins to shrink. The problem with this pill, it does shrink it. Medications are called Avodart or Proscar. You've heard of these probably. The problem is that where the alpha blocker works relatively fast, in a number of days, the patient can say, "Hey, I'm on it." On these, it takes months before you can appreciate the improvement. It does have some unique attributes, but you have to be patient. So if you're going to take this type of pill, and it can be quite effective, you need to stay on it for at least 6 months, maybe a year, before you say either it helps or it doesn't. So you better be patient. Now, someone is going to ask about the next topic. So don't believe everything you read on the internet just because there's a picture of it. That's a quote from Abraham Lincoln. And what am I talking about? Saul Palmetto. So somebody in the room certainly has taken Saul Palmetto or advocates for it. It's every talk I've ever given. "Doc, that Saul Palmetto's doing great." Well, that's good. But when you test it, there's no difference between placebo and the Saul Palmetto itself. So it may be helping you philosophically, psychologically, making you feel like, "Hey, I'm healthy, I'm trying to do something," but it really doesn't impact any aspect of of your health that you can measure. And I wish I had a nickel for every guy that told me, Doc, it's great. Because when we test it scientifically, it's a waste of money. It's your money, not my money. Those are the medications that we'll commonly use when men are bothered. Eventually, or perhaps sooner than later, men will say, you know, I'm tired of taking the pills, or my symptoms just aren't improving enough, and then we'll try some type of a surgical intervention, a surgical procedure. And the first one that I'm going to talk about briefly is laser, very common one is a green light laser. You might have heard that. But essentially, what we do is with a man sedated, we pass a tiny, tiny telescope into the prostate and deliver laser energy to the prostate, and it vaporizes the tissue. And you can open the channel up substantially quickly, go home the same day. It's pretty useful. It's very, very popular with urologists because we can convert most of our old-timey operations into outpatient surgery. They come in, have the procedure, and go home the same day. And it looks like it's quite durable, and it's probably as good as the older types of surgeries that were done 20 years ago. And this is an interesting way to look at it. Interesting way to look at the problem is, how does it change the flow rate? Well, the real standard type of procedures, there's substantial improvement in symptoms and in flow. The medications, not so much. So when the rubber hits the road, you do one of the procedures and you can really hit the ball out of the park, but not everyone's ready to do that from the get-go. So it's certainly appropriate to start with baby steps and move over. Something that is unique to SIU is this new type of therapy we're offering, a vapor. And essentially, we take a tiny, tiny scope, pass it into the urethra, take a small needle, inject it while the man's sedated into the prostate, and deliver vapor energy to the prostate. And it essentially, it's as good as a laser, but it's actually done in the office. It's a substantial improvement in the way we do business. There's very few places in the country that are offering this. We're going to start this off sometime late February. And it's a vapor procedure, so called Resume. But at any rate, it's kind of the cutting edge of prostate treatment. And we're not unique. There's a couple other places in the country and some places in Scandinavia that have used it. I was one of the guys that helped develop it, so that's the reason we brought it here. My last point. Doc, is there anything I can do to help my urination? I mean, not pills, not surgery, anything else I can do. You told me not to take vitamins and not to take sal palmetto. Well, there is, and this is the segue. This is a map of obesity in our country. And if you look over the years, increasing percentage of our population is becoming obese. And it turns out that has a direct relationship to prostate disease. And so we know that as men lose weight, there's a substantial improvement in their urination and a substantial improvement in how fast the prostate can grow or maybe even shrink. So if you're looking for a quick fix, I don't know, but if you're looking for a long-term prevention, it looks like staying physically active is critical. This is a study we published a couple of months ago looking at a group of 3,000 men in Boston, men and women, where we looked at the ability of physical activity to prevent the development of urination symptoms. And as you can see, that the more highly active you are, the less likely you're ever to develop a urination problem from the prostate. It turns out smoking doesn't influence it one way or other, and I was so relieved to find out that alcohol had no influence. Myself and our family is safe. But all kidding aside, physical activity helps your prostate health. It helps a lot of benefits, which you're going to hear about later, but particularly your prostate. So I say this to you. Your prostate health is really an opportunity to improve your overall health. So physical activity, move. It turns out that physical activity helps your heart, it also helps your prostate, and anything that's good for your prostate is good for your heart, and anything good for your heart is good for your prostate. So use that, like a heart diet is a prostate healthy diet. And 10 pounds, huge difference in urination symptoms.